Hi, I'm Dr. Cathy McAdam. I'm the head of General Paediatrics at Monash Children's Hospital. So choking is a common cause of injury and death in children. It's really scary, and so we need to know what to do about it. Young children are particularly at risk of choking because they tend to explore the world orally and put things in their mouth that perhaps shouldn't be there. In addition, they're learning to chew and manage lumps and move them around their mouth. They don't have the molars that help to break food down into smaller pieces, so a large piece may go down and lodge in their airway. Children don't create as much force when they cough to actually expel those pieces. So it's really important that we know what to do if a child chokes. Some of the common choking hazards in children are the small parts of toys, things that break off, pieces of food such as raw fruit and vegetables that they haven't actually broken into a small enough particle. Things like sausages lodge beautifully in a child's throat, so they're particularly dangerous and quite hard for the child to expel. Nuts and seeds can sometimes get caught there. And then there's the things that actually lodge themselves in there, like a fish bone or a broken chicken bone. So it's really important to avoid those. In general, kids tend to choke on items that are smaller than a 20-cent piece. But sometimes larger objects can lodge in their airway, such as a ball or something else like that they can't expel from their mouth. So let's revise the first aid for choking. Most kids you hear choking, and that's because they have a partial obstruction. They can still get some air in and out, and they're going to be able to generate more force to expel that obstruction than you can by intervening at that point. Keep them seated or in the position that they choose and help them to keep on breathing and coughing until the obstruction comes out. Some children will progress to a complete obstruction. That's where they can't get air in and therefore can't generate an effective cough to expel the object. This is called a complete obstruction, and that's where we need to give them some help. We do that through a series of back blows and chest thrusts, trying to keep the head lower than the body so that we can actually get the item to come out. If the child with a complete obstruction then loses consciousness and we lose output, then we're going to have basic life support, doctor's ABCD approach. As we know, prevention is better than a cure. So let's revise a few prevention strategies to try and prevent choking happening in the first place. With children's toys, regularly check them when you're packing them up to make sure that there's no parts that have come loose or are broken. Buy toys that are suitable for that child's age group and read the manufacturer's directions, bearing in mind that some children are a little bit bigger or smaller than the age group recommended. This is particularly important for children with developmental delays, to make sure that they are given toys that are appropriate, because a lot of them will continue to explore things orally well beyond the age at which we expect them to stop doing that. Food preparation and delivery to children is probably one of the biggest areas for intervention. I particularly worry about things like whole grapes. I worry about sausages and need to make sure that they're cut up small enough and that we remove any tough skins that might make it more likely to lodge. Help children to learn to cut their food. And I actually think it's really important that the whole family sits around the table so that they're directly supervised. They're not distracted by something on the TV that might make them go, and you can have a family conversation. So there's all sorts of reasons why we should sit around the table and supervise children and enjoy eating. It's supposed to be a fun activity. If the child's choking, they're usually coughing and often sitting up and forward. They may even splint things so that they can do an effective cough and get maximum force. That's what happens in a partial obstruction. If it's a complete obstruction, they won't be able to cough, and so you're going to try and help imitate that cough by putting them in a position where the head is below the shoulders, but the head and neck are still supported with your hand holding around the chin. You want to do up to 5 back blows using the heel of your hand on the back of the baby between the scapulae. obviously you can stop if the object comes out, or if you hear that they're starting to inhale because they've managed to get it out to a point where they can clear it and spit it. If after those 5 you haven't seen the object come out, roll the child over, again supporting the neck, and have a look in the mouth, and then you would do chest thrusts, again up to 5, in the same position as you do CPR over the lower half of the sternum, usually with a couple of fingers, or in a bigger, heftier child you may need to use the heel of your hand again. It's not on the stomach. We don't want to get into their liver and spleen or cause any problems with their bowel. It's on the breastbone, the sternum in the lower half. So again, and looking to see if something comes out. Continue that until the object is out, or the baby is limp and lifeless, in which case we progress to basic life support using the doctor's ABCD approach. It's really frightening when a child's choking and you can hear them coughing, but it's really important that you don't shake the baby. Okay, sit them up, support them, and see whether they can get it out. If it's an older child who's choking, or an adult, then again support them while they're sitting up and have an effective cough. But if they progress to complete obstruction, the best way is to lay them over your lap, again supporting the head and neck in a more extended sort of position, and do the back blows again between the scapulae. Waiting to see if something will come out, and obviously you can stop if they breathe. If not, then roll them over on their back, and again try to support the airway while you do the chest thrusts over the lower half of the sternum. And you're looking to see if anything comes out. But if they progress to a complete respiratory arrest, you need to do your basic life support. So follow the doctor's ABCD. Move the child to the floor. Move the child to the floor, ensuring there's no dangers where you put them down. Obviously there's no response, which is why you've moved here, so make sure that you send for help and call for an ambulance or some immediate assistance. Open the airway the best you can, and we've already established that there's no breathing from complete obstruction. You may give the 2 rescue breaths because you may actually be able to get some air past the obstruction. If there's no signs of life, you're going to commence compressions. So, and then 2 breaths, and then continue on your cycles of 30 to 2 when there's a sole resuscitator.